America is heading towards a fiscal breaking point. The national debt, retirement programs, and interest costs are all converging into a crisis within the next decade. These are the numbers everyone's ignoring. This is the timeline of America's debt explosion and the breaking point nobody's prepared for. The $38 trillion problem, the United States national debt reached $38 trillion during a 23-day government shutdown in October 2025. This wasn't a gradual climb over decades of careful borrowing. Fiscal year 2025 alone saw the debt increase by $2.17 trillion. That works out to $5.95 billion added every single day. Break it down further and the government borrows $248 million every hour. Every minute adds $4.13 million to the national debt. Every second, $68,902 gets added to what America owes. The federal deficit for fiscal year 2025 totaled $1.8 trillion. This means the government spent $1.8 trillion more than it collected in taxes and revenue. The deficit now equals 5.9% of gross domestic product. The 50-year average for deficits has been 3.8% of GDP. America is running deficits 55% higher than the historical norm during peacetime and economic growth. The debt-to-GDP ratio tells an even more troubling story about scale. The national debt equaled 36% of the entire American economy in 2005. 20 years later, in 2025, that figure approaches 100%. The debt and the economy are now the same size. Congressional Budget Office projections show debt will reach 118% of GDP. Debt held by the public specifically reached $30.28 trillion in fiscal 2025. This represents the portion owed to individuals, businesses, and foreign governments who purchase Treasury securities. It increased by $1.97 trillion in just 12 months. Intragovernmental debt, which represents money the government owes to its own trust funds like Social Security, added another $7.36 trillion to the total. The United States has unseen debt levels this high since World War II. The difference was clear. The country was fighting an existential threat to its survival. Defense spending drove those deficits. After the war ended, spending dropped dramatically and the economy grew faster than the debt. The debt-to-GDP ratio fell steadily for 3 decades. Today's situation contains no such easy resolution path. The country isn't fighting a world war requiring temporary emergency spending. The deficit exists during economic expansion, low unemployment, and relative peacetime. This violates basic fiscal theory about when governments should borrow. Economic textbooks teach that countries should run surpluses during good times and deficits during recessions. America does the opposite. The federal government collected $5.2 trillion in revenue during fiscal 2025. It spent $7 trillion. The $1.8 trillion gap between income and spending created the deficit. That gap has existed for 24 consecutive years. The last time the federal budget showed a surplus was 2001. Since then, the government has added deficits every single year, regardless of which party controlled Congress or the White House. The debt trajectory shows no signs of slowing down naturally. Congressional Budget Office projections estimate debt will grow by $22 trillion over the next decade. That takes total debt from $30.1 trillion in 2025 to $52.10 trillion by 2035. These projections assume current laws remain unchanged. They don't account for recessions, wars, pandemics, or new spending programs. They represent the baseline scenario if nothing unexpected happens. The numbers keep accelerating because debt creates more debt through compound growth. Higher debt means higher interest payments. Higher interest payments increase the deficit. Larger deficits add to the debt. The cycle feeds on itself. The interest payment death spiral. The federal government spent $970 billion on interest payments in fiscal year 2025. This wasn't payment on the principal debt. This was purely the cost of servicing what America already owes. That $970 billion equals roughly $7,300 for every household in the country. It represents 19% of all federal revenue collections. For every dollar the government collected in taxes and fees, 19 cents went straight to interest payments. Interest payments now rank as the third largest government expenditure. Only Social Security and Medicare cost more. Interest exceeded spending on national defense, exceeded spending on Medicaid. It exceeded spending on veterans' benefits, education, transportation, and everything else in the federal budget except those top two programs. The trajectory shows interest costs exploding over the next decade. Congressional Budget Office projections show interest will grow 76% from fiscal 2026 to fiscal 2035. The annual cost rises from $1 trillion to $1.8 trillion over that period. Interest will grow faster than any major budgetary category. By 2035, interest costs will equal 1.7 times total defense spending. The government will spend more servicing debt than protecting the country. Breaking down the daily cost makes the scale more tangible. The Treasury currently pays about $2.6 billion per day in interest on average. That will rise to $4.9 billion per day by 2035. Over the next 10 years, cumulative interest payments will total $13.8 trillion. That represents the highest dollar amount for interest in any historical 10-year period. It equals nearly double what the government spent on interest over the past 2 decades after adjusting for inflation. The average interest rate on total marketable national debt currently sits at 3.406%. That figure has more than doubled from 1.635% just 5 years ago. The rate hasn't increased because bond markets suddenly became more generous. Rates rose because the Federal Reserve raised them to combat inflation. Higher rates mean every dollar borrowed costs more to service. The combination of massive debt and higher rates creates compound pressure on the budget. Interest costs will exceed $1 trillion starting in fiscal year 2026. That represents roughly $40,500 per person across the entire U.S. population. The 9 weeks of fiscal 2026 through November already saw $104 billion spent on interest. That works out to more than $11 billion per week. Interest represented 15% of all federal spending during those first 9 weeks. The interest burden creates what economists call crowding out. Federal spending consists of mandatory programs like Social Security and Medicare, discretionary programs approved annually by Congress, and interest payments. Mandatory spending and interest are legally required. The government cannot simply choose to skip those payments. As interest grows as a share of the budget, it squeezes the discretionary portion. That discretionary spending includes defense, education, infrastructure, research, and most functions people think of as government services. Interest as a share of federal revenues keeps climbing. The figure reached 18.4% by the end of 2025. It will hit 22.2% by 2035, according to projections. Interest as a percentage of total spending will reach 15.6% by 2031. That will surpass the previous high of 15.4% set in 1996. These records keep falling not during recessions or wars, but during economic growth and peacetime. The situation creates a mathematical problem with no easy solution. The government runs what's called a primary deficit before interest is even counted. Revenue doesn't cover program spending. The structural gap between money coming in and money going out exists before adding interest costs. Interest then makes that gap wider. The wider gap requires more borrowing. Our borrowing increases future interest costs. The spiral continues. Higher average interest rates account for about 25% of the projected rise in net interest costs through 2055. Primary deficits account for the remaining 75%. This means the problem stems mostly from spending exceeding revenue, not just from rates. Even if interest rates fell back to historically low levels, the interest burden would still grow because the debt itself keeps expanding. The vicious cycle operates with mechanical precision. Debt generates interest. Interest increases deficits. Deficits add to debt, and the cycle repeats. The loop accelerates year after year with no natural stopping point built into current policy. Social Security's 2033 deadline over the next 2 decades. 77 million baby boomers will retire and begin collecting Social Security benefits. These people are already alive, already approaching retirement age, and already have legal entitlements to these benefits. The program must pay them, The system wasn't designed to handle this wave. The worker-to-beneficiary ratio has collapsed. In 1950, approximately 16.5 workers paid taxes to support each Social Security beneficiary. The program was designed when this ratio made funding simple. Workers contributed a small percentage of wages, and 16 people chipping in could easily support one retiree's benefits. That ratio today stands at roughly 2.8 workers per beneficiary. The system went from 16 supporters per retiree to fewer than 3 in just 75 years. Projections show it will fall further to around 2.1 workers per beneficiary by 2040. 2 workers will support themselves, their children, and 1 full retiree. The mathematics of the program break down completely at this ratio. Social Security beneficiaries will increase by 12 million over the next decade. Another 14 million will be added through 2055. These aren't estimates that might change. These are people who have already been born and will reach retirement age on a predictable schedule. The trust fund depletion date is locked in. The Old Age and Survivors Insurance Trust Fund will pay 100% of scheduled benefits until 2033. After that year, reserves will be completely exhausted. Continuing payroll tax income will cover only 77% of scheduled benefits. This means automatic across-the-board benefit cuts of 23% unless Congress acts before then. The federal government spent $1.6 trillion on Social Security benefits in fiscal 2025. This represented roughly 23% of all federal spending. The program isn't discretionary. Congress cannot choose whether to fund it or not. It's a legally mandated entitlement. Social Security spending will account for 28% of total federal spending growth through 2035. The program will rise from 5.2% of GDP to 7.0% of GDP by 2097 if benefits are paid as scheduled. Meanwhile, Social Security revenues will hover around 4.6% of GDP. The gap between promises and funding keeps widening every year. The fixing mechanisms are all politically toxic. Balancing the books requires either a 30% permanent benefit cut starting immediately, or raising the FICA payroll tax rate from 12.4% to 17.6%. That second option would hit almost every wage earner in America. Social Security cannot borrow money by law. Once trust fund reserves are exhausted, benefits must be cut automatically. Medicare's unsustainable math. Medicare faces an identical crisis timeline as Social Security. The Hospital Insurance Trust Fund will exhaust its reserves in 2033, the same year Social Security runs dry. After depletion, ongoing payroll tax revenue will cover only 89% of scheduled Part A benefits. Hospitals, hospices, and healthcare providers will face an 11% cut in Medicare payments. This depletion date moved up 3 years from the previous year. Projection due to higher than expected hospital and hospice spending. The federal government spent $992 billion on Medicare benefits in fiscal 2025, combined with Social Security $1.6 trillion. These 2 programs consumed $2.6 trillion. That equals roughly 37% of all federal spending going to just these 2 programs. Neither program is discretionary. Both are legally mandated entitlements that must be paid. Medicare costs will explode over the coming decades. The program will rise from 3.9% of GDP in 2025 to 6.2% by 2049. Federal healthcare programs overall will account for 32% of spending growth through 2035. Medicare represents 2/3 of that health spending growth, equal to 22% of total federal spending increases. The combined programs already create nearly $500 billion in annual federal budget shortfalls. Beyond their dedicated funding sources, general revenue from income taxes must fill the gap. This means fewer resources available for everything else in the federal budget. Medicare and Social Security crowd out defense, education, infrastructure, and all other government functions. Medicare operates under different funding rules that make the crisis more complex. Part A, the hospital insurance program, works like Social Security with a dedicated trust fund. It faces the 2033 depletion date. Parts B and D, covering physician services and prescription drugs, are funded differently. They draw from general revenues and beneficiary premiums. These parts cannot become insolvent by definition because their financing is set annually by law. to cover costs. The problem with Parts B and D is relentless growth. Spending on these parts will grow significantly faster than GDP, consuming an ever larger share of the federal budget. The government must find money somewhere else in the budget to pay for this growth. Every dollar going to Medicare is a dollar unavailable for other priorities. The demographic transformation is irreversible. Birth rates will not suddenly surge. Baby boomers will not stop aging. Life expectancy continues increasing, meaning beneficiaries collect payments for many more years than Medicare was designed to support. By 2034, adults aged 65 and over will outnumber children under 18 for the first time in American history. The spending revenue gap, the federal government will spend approximately 24% of GDP over the next decade. It will collect only about 18% of GDP in revenue. This 6 percentage point gap represents the core structural problem destroying America's fiscal future. The gap exists before accounting for recessions, wars, emergencies, or new programs. This is the baseline, assuming nothing unexpected happens. The numbers translate to $88 trillion in spending over the next 10 years against $65 trillion in revenue. That creates a $23 trillion shortfall that must be borrowed. The government will borrow $23 trillion just to maintain current operations under existing law. Any new program, any tax cut, any emergency adds to that figure. Federal spending has risen from 20.9% of GDP in 2019 to 23.4% in 2024. It dipped slightly to 22.8% in 2025 due to one-time adjustments for student debt policies. The trend line points upward from there, reaching 23.6% of GDP by 2035. Historical context makes this stark. Federal spending averaged 21.1% of GDP over the past 50 years. Current spending runs 2 to 3 percentage points above the long-term average, with no plan to bring it back down. Revenue has increased from 16.3% of GDP in 2019 to 17.2% in 2025. It will rise to 17.7% of GDP by the end of the decade under current law assumptions. That assumes many provisions of the Tax Cuts and Jobs Act expire at the end of 2025 as scheduled. If those tax cuts are extended without offsetting revenue increases, the actual revenue figure will be lower. Historical revenue averaged 17.3% of GDP over the past 50 years. Current projections sit right at that average. The revenue side shows no natural growth mechanism. Tax collections grow roughly in line with the economy. GDP growth determines how much taxable income exists. The tax code determines what percentage gets collected. Without raising tax rates or eliminating deductions, revenue stays locked around 17% to 18% of GDP. That has been the pattern for 50 years, regardless of what tax rates actually were. Revenue as a share of GDP proves remarkably stable across different tax policies, where every dollar goes in 2025. Total mandatory spending and net interest approximately equal total revenues collected. This means every single dollar of discretionary spending appropriated by Congress is borrowed money. Defense spending, veteran benefits, education, infrastructure, scientific research, and everything Congress votes on annually gets paid for with debt. Social Security, Medicare, and net interest will grow from 49% of total expenditures in fiscal 2025 to 58% by fiscal 2035. These three categories alone will account for 82% of all spending growth over the next decade. Social Security represents 28% of spending increases. Federal health programs represent 32%. Net interest represents 22%. Together, these three categories consume the entire growth in federal spending. Everything else in the budget gets squeezed. The spending side shows no natural limits. Social Security and Medicare spending is driven by demographics that cannot change. The number of retirees is fixed. Their benefit levels are set by formula. Interest costs are driven by existing debt and prevailing interest rates. The government cannot simply choose to pay less interest. These are contractual obligations. The only discretionary element is the annual appropriations Congress votes on, and that category shrinks as a share of total spending. The gap between 24% spending and 18% revenue cannot close through economic growth alone. The economy would need to grow dramatically faster than projected to generate enough additional tax revenue. Even strong growth increases both sides of the equation. Higher GDP means more tax revenue, but also higher Social Security benefits tied to wage growth and higher Medicare costs from increased economic activity. Growth helps but doesn't solve the structural imbalance. Primary deficits, which exclude interest payments, average 2.0% of GDP over the next 30 years. This means even before paying interest, the government spends 2% of GDP more than it collects. Add interest costs, and total deficits average 6.3% of GDP over 30 years. For context, primary surpluses occurred in one-third of years between 1975 and 2007. None have occurred since 2008. The government has unrun a primary surplus in 17 consecutive years. The structural imbalance between spending and revenue represents the engine driving debt to unsustainable levels. The 2029 breaking point federal debt will surpass its historical peak in 2029. That year marks when the United States exceeds the post-World War to record for debt as a percentage of the economy. The debt-to-GDP ratio will hit 107% by the end of fiscal 2029. The previous record of 106% occurred in 1946. The difference is fundamental. World War II debt financed an existential fight for survival. After victory, spending dropped, and the economy grew faster than the debt. Today's debt exists during economic growth and low unemployment. No war justifies it. No crisis created it. Traditional fiscal theory says government should run surpluses during good times. America does the opposite. Available fiscal space totals only 6% of GDP today. That figure will decline to 1% by fiscal 2028. By 2029, it will virtually disappear. Fiscal space represents the government's capacity to respond to crises through borrowing. The 2008 financial crisis and COVID pandemic were both fought with massive deficit spending. That option won't exist for the next emergency. Trajectory accelerates beyond 2029. Debt will reach 118% of GDP by 2035, growing from $30.1 trillion to $52.1 trillion. These projections assume nothing goes wrong. They don't account for recessions, wars, or pandemics. The long-term picture is catastrophic. Under current law, debt will swell to 156% of GDP by 2055. In an alternative scenario, where tax cuts are extended permanently, debt could surge to 220% of GDP by 2055. The economic consequences are severe. Rising debt would reduce average income growth by 16% between 2025 and 2055. For every dollar the government borrows, private investment falls by 33 cents. Higher debt crowds out productive economic activity, leaving future generations poorer. The 2029 threshold represents the point where America's debt exceeds any level in history outside of total war. What happens when it breaks? The convergence of all these crises happens simultaneously. Social Security and Medicare both hit insolvency in 2033. Debt exceeds World War II records in 2029. Interest payments consume an ever larger share of tax revenue. The spending revenue gap continues widening. So these aren't separate problems arriving at different times. They all crash into each other within the next decade. Government faces impossible choices when the breaking point arrives. Cutting Social Security benefits by 23% throws millions of retirees into poverty. Cutting Medicare payments by 11% forces hospitals to limit services or exit markets entirely. Raising taxes enough to close the gap requires increasing rates to levels that damage economic growth. None of these options are politically feasible, yet mathematics demands one of them. The risk of a fiscal crisis grows with every passing year. Bond markets could lose confidence in America's ability to service its debt. Interest rates would spike as investors demand higher compensation for risk. Higher rates would make the debt burden even worse, creating a downward spiral. The United Kingdom experienced a miniature version of this in 2022 when bond markets rejected the government's fiscal plans. Prime Minister Liz Truss resigned after just 6 weeks. The generational burden falls hardest on younger Americans. They will pay higher taxes to service debt they didn't create. They face reduced access to Social Security and Medicare after funding those programs for current retirees. They inherit an economy with less productive investment and slower growth. The federal government spent $1.6 trillion on Social Security and $992 billion on Medicare in fiscal 2025. Programs primarily benefiting older generations. Younger workers fund these programs while their own future benefits remain uncertain. The math is clear, and the system is moving steadily toward a breaking point that can no longer be avoided.